in order for us to have a better understanding of alcohol use disorder, addictions, and how we can approach treatment for this condition, we have to have an understanding of how alcohol interacts in the brain. The next few slides here will discuss how neurotransmitters in the brain are affected by alcohol and how these chemical messengers and signals can be used to find appropriate treatments which are targeted to a specific patient and the symptoms that they are struggling with. So there's a concept called the reward pathway. For every substance, there's slightly different effects on the brain, but all addictive drugs, including alcohol, opiates, and cocaine, produce a pleasurable surge of a neurotransmitter called dopamine in the region of the brain called the basal ganglia. This area is responsible for controlling reward and our ability to learn based on these rewards. As substance use increases, these circuits adapt. They scale back their sensitivities to dopamine, which leads to a reduction in the substance's ability to produce a euphoria or a high. This is what we call tolerance. And this reflects the way that the brain maintains an imbalance and adjusts to a new normal, specifically when alcohol is around chronically. However, as a result, users often increase the amount of substances they're ingesting to reach that same high that they were achieving prior to a previous volume of alcohol. Unfortunately, these same circuits control our ability to take pleasure from ordinary reward as well, such as food, sex, social interaction, exercise. And when they're disrupted by substance use, the rest of life can feel less enjoyable, which is how some people will experience depression from chronic alcohol ingestion. And this is why you'll often hear people say they start drinking to feel good, but as they drink chronically, they have to drink to avoid feeling bad. Other important neurotransmitters and portions of the brain that are important in alcohol consumption are GABA, serotonin, and glutamate. GABA is one of the neurotransmitters that's involved with movement, primarily when alcohol is around. This is what drives sluggish movement, slurred speech, and slowed reaction times in someone who's intoxicated. And oppositely, once these are upregulated in someone who chronically drinks and then they stop drinking, this is what causes someone to have the opposite effect. So they become tremulous, they have palpitations, and sometimes even seizures and severe alcohol withdrawal. These neurotransmitters also affect areas of the brain such as the cerebellum. Cerebellum is important for balance and our gait or our ability to walk, as well as our vision. This is why when someone's intoxicated, they get the spins or they feel unsteady on their feet or they might experience blurred vision. Again, in alcohol withdrawal, someone might experience hallucinations. Or in severe chronic alcohol use, there's something called Wernicke's encephalopathy, which chronically or permanently impacts our balance as well as our vision and overall cognition as well. Another important area of the brain is the hippocampus, which is involved in memory. Alcohol impacts this area of the brain by causing blackouts, impairs our short-term and long-term memory. And there's also the prefrontal cortex, which is an important part of the brain that is involved with our personality and our judgment. So for people who are intoxicated, they become more impulsive. They may engage in risky behaviors. They often will have loved ones that say they are not themselves when they're drinking alcohol. So certainly this is a simplified understanding of the neurochemistry that is taking place in the brain, specifically with addiction and more specifically with alcohol. However, it is important to have a basic understanding of this when looking at an individual patient and seeing what symptoms they're struggling with and what are their barriers to stopping alcohol. There's certainly more than just a moral failing involved with someone who's consuming alcohol chronically and their challenges with alcohol cessation. There certainly is some physiological grounds to why they may be struggling. And I think these concepts are very important for us to understand which treatments they may benefit from and which areas of the brain we are targeting when choosing medications that might support their abstinence or help them reach their drinking goals.